Did you know that pain near your back isn't always coming from your back? A sore muscle can feel scary, a kidney problem can feel sneaky, and both love to pretend they're the same thing. One wrong guess can mean wasted time, wrong meds, and a lot more discomfort than anyone needs. Some clues show up fast if you know where to look, how the pain moves, and what your body is quietly doing along with it. And this video breaks down the real differences so you can spot them quickly and trust your instincts. Core difference of kidney and back pain. When you come in with pain near your back, the doctor starts with the simplest clues your body gives. Kidney pain usually settles in the flank area, tucked between your ribs and hips, and it often stays on one side. But the back pain doesn't follow that pattern. It can appear anywhere along your back. But most people feel it in the lower back or deep in the buttocks. The way the pain feels also speaks. Kidney trouble may arrive as a sharp, gripping pain when stones are involved, or as a steady, dull ache when infection or even cancer is the cause. Back pain more often feels throbbing when muscles are strained, or sharp and burning when a nerve is irritated. The doctor also pays close attention to movement. Kidney pain is often constant and doesn't change much when you shift, bend, or walk. Back pain usually responds. It often worsens with long sitting or standing, then eases when you change position or activity. Kidney pain is often paired with whole body symptoms, while back pain is more often joined by muscle or nerve symptoms. How to identify kidney pain? Number 1. Location. One of the earliest clues often comes from where the discomfort settles. Kidney pain is most often felt deep in the flank, on either side of the spine between the lower ribs and the hips. It usually doesn't feel close to the skin the way sore muscles do. Instead, it feels buried, harder to touch or trace. That sensation may also show up along the side of the body, in the abdomen, or even in the lower back, which is why kidney trouble is so often confused with back strain. Many people notice it on only one side, though both kidneys can be involved, and when they are, pain may appear on both sides. Number 2. Type of pain. The nature of kidney pain shifts with its cause. Stones often trigger sharp, cutting pain that can strike suddenly and feel intense. Infections more commonly bring a dull, heavy ache that lingers. Kidney pain is frequently constant, staying present even during rest. When a stone is moving through the urinary tract, the sensation may rise and fall as it travels. Kidney cancer may create a persistent dull ache stretching from the middle of the back toward the ribs. Polycystic kidney disease can lead to episodes of severe pain as cysts grow or complications develop. Number 3. Radiation. Kidney pain doesn't always stay in one place. It can spread forward into the lower abdomen or move downward toward the inner thigh. This outward path is one of the reasons kidney-related pain often feels strange, hard to locate, and emotionally unsettling. Number 4. Severity. The strength of kidney pain varies widely. Some people feel only mild, nagging discomfort. Others experience severe pain that grips attention and interrupts daily life. Stones and cysts are more likely to cause intense pain, while infections tend to produce milder but steadier discomfort. Intensity alone doesn't explain the cause, but it often signals how urgently care may be needed. Number 5. What makes it better or worse? Kidney pain behaves differently from most back problems. Movement usually doesn't change it much. Shifting positions, stretching, or walking rarely brings real relief. Improvement most often comes only after the underlying issue is addressed, whether that means passing a stone, taking medication for an infection, or receiving surgical treatment. Number 6. Accompanying symptoms. Kidney pain is often paired with other body changes. These may include fever and chills, nausea and vomiting, cloudy or dark urine, an urgent need to urinate, pain during urination, or a recent bladder infection. Blood in the urine or tiny gravel-like stones may appear. Fatigue or a noticeable lump on the side or lower back can be linked to kidney cancer. Polycystic kidney disease may also bring stomach or lower back pain, high blood pressure, kidney stones, and kidney failure. How to identify back pain? Number 1. Location. When back pain is the source, the discomfort doesn't stay confined to one narrow zone. It can appear anywhere along the back, from high near the shoulders down to the base of the spine. That said, it most commonly settles in the lower back or deep in the buttocks. Some people feel it spreads across a broad area, while others can point to one sore region. Unlike kidney pain, back pain often feels closer to the surface, easier to trace with a hand, and more clearly linked to posture, strain, or movement. Number 2. Type of pain. Back pain changes character depending on what structures are involved. When muscles are strained or overworked, the pain usually feels like a throbbing, aching soreness. Nerve-related back pain is different. It often feels sharp or burning and may travel from the back down through the buttock, into the leg, and sometimes all the way to the foot. Muscle pain may affect one side or both. Nerve pain, however, usually favors one side. With osteoarthritis, discomfort often increases over time, and stiffness is especially noticeable in the morning before the joints loosen. Number 3. Traveling pain. The way back pain moves can offer important clues. Herniated discs and other nerve problems commonly cause pain that spreads into the lower leg. That traveling pattern often follows the path of irritated nerves. Muscle-based pain behaves differently. It usually stays rooted in the back itself and does not extend far beyond the sore area. Number 4. Severity timeline. Back pain is often described by how long it lasts. Acute back pain is the most common and usually lasts from a few days to a few weeks. Subacute pain lasts longer, from about 4 weeks to 6 months. Chronic back pain continues beyond 3 months. This timeline helps distinguish short-term strain from longer-standing conditions that may need deeper evaluation. Number 5. What makes it better or worse? Back pain typically relates to how you use your body. It often worsens with movement, long periods of sitting or standing in one position. Relief may come when you change positions, walk, or shift activities. With sciatica, pain may intensify when bending forward or even when coughing. Number 6. Accompanying symptoms. Back pain is often joined by local signs. The area may look swollen or feel tender. Muscle spasms, stiffness, and reduced flexibility are common. If nerves are involved, numbness or weakness may appear in one or both legs. Osteoarthritis may cause a grinding sensation with movement. Loss of bladder or bowel control is a medical emergency and may signal cauda equina syndrome, which requires immediate care. Causes of kidney pain. Well, one of the most common causes is kidney stones. These form when minerals collect and harden inside the kidneys. Some remain small and quiet. Others grow or begin to move, scraping along delicate passages. When that happens, pain can rise suddenly and sharply, sometimes becoming severe enough to stop everything else. Stones don't just irritate tissue, they can block urine flow, which increases pressure inside the kidney and intensifies discomfort. Another frequent cause is pyelonephritis, a kidney infection that develops when a urinary tract infection travels upward from the bladder. Instead of staying local, bacteria reach the kidneys and inflame the tissue. This kind of infection often creates a deep, steady ache rather than sudden stabbing pain. Because the kidneys are involved in filtering the blood, infections here can affect the whole body, not just the urinary system. Without treatment, kidney infections can become serious and lead to lasting damage. Hydronephrosis is another condition that can trigger kidney pain. This happens when urine cannot drain properly and begins to build up inside one or both kidneys. The trapped fluid causes the kidney to swell. That swelling stretches internal structures that were never meant to expand, creating pressure and discomfort. Hydronephrosis is not a disease itself, but a result of something blocking urine flow, such as stones, narrowing of the urinary tract, or other obstructions. Kidney cancer is a less common but important cause. Tumours can grow quietly for a long time before pain appears. When discomfort does develop, it is often described as a persistent dull ache rather than sharp pain. As a mass enlarges, it may press on surrounding tissues or disrupt blood flow, leading to ongoing discomfort that doesn't resolve on its own. Polycystic kidney disease is a genetic condition that causes clusters of fluid-filled cysts to grow throughout both kidneys. Over time, these cysts enlarge and crowd healthy tissue. As the kidneys expand, they can become painful. This condition may also interfere with kidney function and, in advanced stages, can lead to kidney failure. Pain from polycystic kidney disease may come and go, often increasing as cysts grow or complications develop. Causes of back pain. All right, when back pain starts, it is usually because something has disturbed the structures that hold the spine together and allow it to move. One of the most common reasons is muscle strain or injury. This can happen from lifting heavy objects, sudden movements, accidents, or repeated stress over time. Muscles, tendons, and connective tissues can become overstretched or damaged, leading to inflammation and pain. Spine irregularities are another source. Conditions such as scoliosis change the natural curve of the spine. When the spine is not aligned properly, weight and pressure are distributed unevenly. Over time, this imbalance places stress on muscles, joints, and supporting tissues, which can gradually lead to ongoing back pain. Osteoarthritis is a frequent cause as well. As cartilage between the joints of the spine breaks down, the bones lose their smooth protection. This wear allows the joints to rub more directly, which contributes to stiffness and discomfort that often progresses with age. Sciatica develops when the sciatic nerve becomes compressed or irritated. Because this nerve runs from the lower back into the legs, pressure along its path often creates back pain connected to nerve involvement. Herniated or slipped discs are another major cause. When a disc bulges or ruptures, it can press against nearby nerves or the spinal cord. Degenerative and nerve problems often develop alongside these changes as spinal structures weaken over time, making back pain more likely to persist. Treatment of kidney pain. When kidney pain is present, treatment focuses on correcting the problem inside the kidneys rather than masking discomfort. Infections are commonly treated with antibiotics, which work to clear the bacteria responsible and allow the inflamed tissue to heal. For people with polycystic kidney disease, blood pressure medication is often necessary, since this condition frequently leads to hypertension that further strains the kidneys. When kidney cancer is involved, treatment may include immunotherapy and targeted medications designed to slow or block cancer growth. Drugs such as sorafenib and pazopanib are used to interfere with signals that help cancer cells survive. In some situations, surgery becomes necessary. This may involve removing only the affected portion of a kidney, or when damage is extensive, removing the entire kidney. If both kidneys are severely impaired, a kidney transplant may be required to restore long-term function. Supportive care also plays an important role. Drinking plenty of water helps flush the urinary system and supports kidney function, especially in people prone to stones or infections. Maintaining a healthy diet and moderate body weight may help reduce the risk of kidney stones and may also support prevention efforts related to kidney cancer. Treatment of back pain. Well, if we talk about back pain, it was managed through a mix of medical care, physical support, and lifestyle adjustments. Pain relief options often include acetaminophen and non-steroidal anti-inflammatory drugs to reduce discomfort and swelling. When inflammation is more severe or nerve irritation is involved, steroid injections may be used. Muscle relaxants are sometimes added when tight or spasming muscles are part of the problem. Longer-term improvement often comes from physical therapy and core strengthening exercises that help stabilize the spine and protect it during movement. Some people also use acupuncture or massage to ease tension and improve circulation. Hot or cold packs are commonly applied to soothe sore areas and manage swelling. Lifestyle changes and weight loss can lower stress on the back and support recovery. In more serious cases, surgery may be required, including correction for scoliosis, stabilization for osteoarthritis, or procedures to relieve nerve pressure from a herniated disc. When to see a doctor. Certain signs mean pain should not be handled alone. Pain centered in the kidney area, suspicion of a kidney infection or kidney stone, fever paired with pain or blood in the urine all call for medical evaluation. Severe pain, pain that spreads, or discomfort that does not improve also deserves professional attention. Loss of bladder or bowel control is an emergency and requires immediate care. To find the cause, a doctor may use a urine test to check for blood, minerals, or infection, a blood test to assess kidney function, and imaging such as a CT scan or ultrasound to look for stones, swelling, or other internal changes. Pain doesn't show up without a reason. The more you understand what your body is saying, the faster you can protect it. So, you found this video helpful? Then tap like, subscribe for more real health breakdowns, and share this with someone who might need it. Take care. Thanks for watching and being with us till here.